Being a healthcare hero, how to be your best advocate. Chloe Sitch, Susan, Maggie, and Aaron. Who am I? My name is Chloe Sitch, and I am a 30-year-old young adult with spina bifida, hearing loss, ADHD, autism, and PTSD. I'm an adult advisory board member for the Spina Bifida Association's Georgia-Tennessee chapter. I also do a bunch of social media content. Links to come later. Last year, out of the 166,000 plus individuals with spina bifida, I won the Young Adult Advocacy Award. Therefore, I feel qualified to talk about this. Who am I? If you feel so inclined, you can follow me on my socials where I talk about this topic and advocacy in general. How I got started. My dad passed away in August of 2022. He was in denial of my needs. I felt like I could truly be myself after he had passed away. My family was upset that he had passed. I did not want to be someone who was stuck in a depressive state, so I decided to become an advocate and provide free resources on my YouTube channel, as well as dive into other advocacy avenues. Advocacy. Now that we have the boring stuff out of the way, let's get into the meat and potatoes of this presentation. You are never too young or too old to start advocating for your health care. Advocacy cons. The provider is not trained on how to work with disabled individuals. The provider doesn't see the disabled person as capable of making their own decisions. Guardianship or conservatorship. The provider asks the parent/caretaker instead of the disabled person. Advocacy cons continued. The parent does not want the disabled person advocating. Things like masking, high pain tolerance, chronic pain, amongst others, can make it difficult to express pain levels accurately. Some people may be uncomfortable about certain topics, i.e. ABA, vaccines, etc. Fear of being abused by parents for speaking out. Advocacy cons continued. Trauma, parents not knowing how to cope / in denial. Sensory sensitivities. Things that were said to me / my community. I have to get done a urodynamics as needed. My urologist cannot put the catheters in me because he is a male, so his assistant did it, female. Her and I were yapping. I told her I was autistic, and she told me that I was person with autism and not autistic person. I decided to let it go because it is hard to find an adult clinic and everyone else is fantastic. Sometimes you have to pick and choose your own battles, and she got the job done. Things that were said to me / my community continued. Every year, the Spina Bifida Association does something called Teal on the Hill, where we virtually get together with our members of Congress and advocate for change. My state, Georgia, got paired with advocates from Florida and Alabama. Things that were said to me / my community continued. University of Alabama at Birmingham has an adult clinic, and the Children's Hospital has a pediatric clinic. As many clinicians from the clinic came on with no adults with spina bifida present. The neurosurgeon was stating how spina bifida is a disease. It is not, for it is a birth defect. Other clinicians followed suit. They also said that they were the best clinic, the first adult clinic, and were the /1 contributor to the National Spina Bifida Patient Registry. None of this was true, and I had facts to back it up. Things that were said to me / my community continued. It was giving, get off your steroids, get a margarita, maybe sprinkle in some Xanax, and chill, 'cause y'all ain't it. My friends and I, there were only 4 adults, stepped up and said it was not a disease, and we had phenomenal qualities of life. They left immediately after the meeting. I think we scared them away. I reported them to the COO of the SBA because this is not the first time that they have done this. Advocacy pros. Get exactly what you need. Speaking up for the less vulnerable. Paving the way for future generations. Shining a light on important topics. Bringing awareness. What happened will hopefully not happen again. Examples of advocacy. I do something called transanal irrigation for my spina bifida. However, it is only covered under Georgia Medicaid for individuals 21 years of age and younger. I contacted my Medicaid's policy department. Georgia Medicaid refuses to answer their phone, so I had to send them an email. They sent me a robo-reply stating they would get back to me ASAP. Examples of advocacy. I waited a couple of days and heard nothing. I sent them an email, and in that email specifically stated that I was going to sue them if they did not get back to me. Guess who got back to me the next day? They got me in touch with someone to get me on the now/comp waiver. I told them that was not feasible because they would not cover it and there's a 10-year waiting list. Examples of advocacy. The woman who was helping me said that she had not heard of the wait list and still sent me over. I asked if this policy could be changed and if she could not help me to transfer me over to someone who can. She sent everything over to someone else. I asked for the contact info and she refused to give it to me. I waited and ultimately the decision got denied to change the policy. Examples of advocacy. I reported her to the Office of the Inspector General and Medicaid fraud, and they're launching an investigation. I'm now working on getting an external review. How to choose a good doctor. So I have no adult spina bifida clinic in my state. I went on the Spina Bifida Association's website and went under their Find a Clinic page. Now, as an adult with spina bifida, there are not a lot of clinics for us, so I had slim pickings. I looked up how each hospital ran their clinic and what kinds of doctors they had staffed in the clinic. I picked my top 3 and called each one. How to choose a good doctor continued. Penn State Medicine and Hershey decided to take on my case. I have been seeing them ever since, and I'm moving up there by the end of this year. Other things to look out for. This is assuming you're not in my position. Google them and read their reviews. Be sure they are in the same state as you, or you can do telehealth visits in your state. Be sure they are knowledgeable about your condition. Be sure the doctor and the facility take your insurance. Be sure the practice has good reviews. Be sure you know your copay. Be sure you can do the date provided. Be sure you have a way to get there. How to find out your copay. Most health insurances have a phone number on the back of your card. You can call them and ask. Most health insurances have a portal that you sign up for. What your copay is will be different than someone else who sees them because insurances have different rates. If you have met your deductible, etc. Example, let's say I'm on Cigna and my friend is on Anthem. We both see Dr. Brasher and her rate is $50. I have met my deductible, so I owe nothing, and my friend owes $50 because she has not met her deductible. Be sure you know what it is before you go. No Surprises Act. The No Surprises Act went into law in January 2022. By law, your provider/their office has to let you know ahead of time how much everything is going to cost, unless it is an emergency or you need additional stuff because they found something else. Example, let's say I'm seeing Dr. Brasher for an appointment. I asked the billing and insurance department how much it costs to see her. They said they don't know. That is illegal. Not many offices follow this because they are greedy and do not want you to know. Prior authorization. Some things need to be approved by your health insurance before it can be given/you can be seen/it can be done. This is known as prior authorization. What happens is your provider or their billing/insurance department will start the process. Then the health insurance has doctors that they contract with to make the decisions. They will then look at everything and make the decision. Prior authorization continued. By law, any insurance has 30 days to prior authorize it. Now, if it's an emergency, the doctor will put that in writing and they will have to get back ASAP. Prior authorization continued. However, there's a way to get something covered faster. Every health insurance has something called a prior authorization and management team. It may be called something different within each insurance. Just call the number on the back of your card or email them every day asking to be transferred. They may say no, so ask for a status update. I did that for my wheelchair when I had Anthem, and my wheelchair got approved within a week. Keep in mind, government agencies like Medicaid and Medicare are lazy and take their sweet time. My prior auth/claim was denied. What do? Do not panic. This could cause you to get anxious and or go into a mental spiral. All insurances have booklets of coverage. You can either call insurance or if your job gave it out, you can talk to HR. Ask them if the thing is covered. Now, sometimes insurances will only allow a certain amount of something per year. This is most common with physical, speech, and occupational therapy. If you have met the maximum amount of visits, you cannot get any more. My prior auth/claim was denied. What do? If this is not reoccurring, call or email your insurance and ask why it got denied. Also ask what type of physician denied your claim. This is because some health insurances use the wrong type of physician and do not want you knowing. For example, let's say I need Zoloft for my PTSD. My psychiatrist sent the script into my insurance. They give it to a gastroenterologist to look at and they deny it. They know nothing about PTSD and should not have gotten their hands on that. Ask them to have the proper person review it. My prior auth / claim was denied. What do I do? Continued. If that does not work, it is time to work up the chain of command. First off, your doctor will have to file an appeal. If that does not work, your doctor will have to do a peer-to-peer. This is where the doctor has to call insurance and talk to someone directly. If that does not work, you will have to attain a hearing in front of a group of doctors not affiliated with your insurance and testify. If you win at any point in time, you can get what you need. So on this next slide, media attention. What do a narcissist, a celebrity, and health insurance have in common? They do not like bad media press. Getting attention from your local news station or even calling them out on social media and tagging them can have a big impact. This is because what happens is the public can see it, they call them out, important people find out, stocks go down for them, equals no fancy yacht or mansion for the CEO. So they cover it. Now on this slide, which is what I meant to say, we're going to get graphic, with a graphic that is, and more specifically, a graphic of steps. So you can screenshot this if you want, and you can use it for your own personal gain if you want. But claim prior authorization got denied. You then have to check the booklet of coverage or call to see if it's covered in the first place and how many visits. Have your doctor appeal it. Doctor does peer-to-peer. You go for a hearing. Can have media attention brought in at any time. And again, if they approve it before you go for the hearing, then you don't have to do the rest of it. So like for instance, if your doctor appealed it and they approved of it, then you don't have to do the peer-to-peer or the hearing. What if my disabled individual gets kicked off my insurance once they turn 26? Some health insurances have a disabled dependent form where you can allow them to stay on their insurance. Just give the insurance a call before they turn 26 to get it taken care of, because this also needs to be prior authorized. Now, most Obamacare plans do not allow this. Once a disabled individual turns 18, they are not tied to their parents' income and can file for Medicaid as long as they meet the money limits. They can also get insurance through the marketplace. If they are still on your employer's insurance, they can also have Medicaid. The way things are covered is like going to lunch with a friend. One person pays their share and Medicaid picks up the rest, as long as both insurances are in network. What if I need to see someone out of network regardless if they are in state or not? If you have PPO insurance or original Medicare, it can be used out of state. HMO and Medicaid cannot. However, there is an exception called a single case agreement. This is a contract between your insurance and the person you want to see. This allows the insurance to bill them as if they were in network. What if continued? Now, if you are on Medicaid, this only works if there is no one in your state that knows about your condition, regardless of how bad the provider is. Now, let's say you have a urologist down here, but no one else in the place you're going to has a multidisciplinary clinic with a urologist. You can see them too. If you are going out of state, anything you need gets covered as long as your Medicaid will cover it. What if continued? I can only speak to Medicaid about getting it approved. I had my primary care initiate this. Medicaid wanted a letter from my spina bifida clinic at the codes for what I was getting, how much it typically costs through them, and the lowest they would accept. They then work on approving it and will send you a letter of approval. I highly recommend doing this in advance because it needs to be prior authorized. Now, you or your provider may not know everything you need to get done. That is okay, and they can put down what they are 100% certain they're going to do. What if I cannot afford travel? I know Medicaid has something called exceptional transportation services. Once you get the letter of approval, for your place, you can start the process. I have not gotten there yet, but they will pay for a flight and hotel rooms for the person receiving care only, unless if they are not able to go by themselves due to a disability. So like if you're deaf or if you have an intellectual disability, they'll cover somebody else to go with you. What if I cannot get a ride to my appointment? Most insurances, including Medicaid, have non-emergency medical transportation companies. With Medicaid, they use Verida. They offer free rides. Private may make you cough up some of the costs, though. What if, continued, you must call 3 days in advance. You can have an attendant or a parent/caregiver with you in the vehicle. They will ask you where you're going and a series of questions. If you use a wheelchair or stretcher, they have to give you a wheelchair accessible ride and cannot give you a Lyft or an Uber. If you do not use any of that, they will offer you a lift. This also works out of state. What if I cannot afford my medication? GoodRx has coupons, but it is only if you do not have insurance or you are on Medicaid and the provider is out of network. See about a generic or talk to your doctor about a drug in the same class that has a generic. What if I am on a generic and I'm going crazy? I'm looking at you, Vyvanse. We have seen this with Vyvanse. The best thing to do is explain everything to your doctor and have them write a letter to insurance asking for the real thing. It'll be more expensive. Or try another drug within the same class. What if my provider is not listening to me or my disabled individual? Call them out, switch providers, if needed, file grievance with your insurance. What if, an example of grievance, an ENT practice I was going to got a new audiologist. She did not want to be there and did not like her job. She also refused to go over my hearing test results. I reported her and never went back. Wants and needs. Non-speaking individuals, ones that are mute or ones that have PTSD and have to face a trigger, may have a harder time expressing their wants and needs or get babied. How can we fix this? There's not going to be a one-size-fits-all solution. Allowing a comfort item, I bring my stuffed teddy bear, allow fidgets and headphones. Food in the hospital. True story, I had to get tear duct block surgery when I was in the 5th grade. So this was like in the 2000s, somewhere around there. Before I can go home, I needed to drink grape juice, a popsicle, or apple juice. My mom asked the nurse if I could have water because I would not drink any of that. She said no. We took the apple juice, but I was in distress, and we eventually spilled it out when the nurse left, and we told her I finished it. This can also apply to individuals with ARFID. Food in the hospital, continued. For example, let's say I like mashed potatoes and the hospital serves them. I do not know how they are cooked and if they will taste the same as if I cooked them. I also do not know what brand if they just get microwavable ones. Therefore, I will not eat them. This can lead to malnutrition. Food in the hospital, continued. How do we combat this? Individuals and parents can bring safe foods. They can also buy them at the hospital gift shop or get them door-dashed. Also, you can either get groceries delivered or go to a grocery shop. If the hospital has a microwave, you can heat up whatever they like, i.e. a certain brand of mashed potatoes that they like. You can also have someone else get it for you. This also goes for drinks. Sensory sensitivities. As we all know, autistic individuals have sensory sensitivities, which can make getting care difficult. These can also be heightened if they have PTSD or do not have access to resources in their area to get help. Sensory sensitivities, continued. How can we be more supportive of these sensory sensitivities? The individual can wait outside or in the car, and you can call their phone when it is their turn to go back. Take them back right away. Provide fidgets. Allow them to touch items when available. Allow movement breaks. Allow them to do what you need to get done in a place that best suits them, i.e., they like the space decals on the wall in the room next door. Telehealth. This is a great option for people that have PTSD, do not have a ride, or people that live too far away. However, some people are on SSI or a similar program and cannot afford Wi-Fi. Some individuals live in a town or place with no Wi-Fi. They live in a public setting like a group home and have a shared room and will get no privacy. Their parent coached them to lie and say that everything's fine. Rural areas. Some individuals live in a rural area and do not have the resources or hospitals available. This is also one of the reasons why you have two autistics with the same diagnosis from different places that act differently. For example, I have the Emory Autism Center within an hour's reach of me. Now let's say my friend who's autistic lives in Blue Ridge and has nothing. She would not be able to get the help she needs. Parents/caretakers. Most parents/caretakers of autistic individuals or any disability do not know how to cope. Autistic individuals can feel empathy, but it is more relative empathy, feeling what someone else is feeling, and not cognitive, identifying the same emotion as someone else without feeling it. Because of both of those things, this is one of the main ways disabled individuals get PTSD. Let's say, for an example, an autistic individual needs a blood draw. The individual is scared. You then lash out at the doctor and say, "Is this really necessary?" Even though it is. Now, not only will the autistic individual be more scared, but will associate this with a negative experience, all because of how their parent acted. We are taught how to cope with this, but parents need to learn too. Parents/caretakers continued. Most of the time, the parent is unable to cope because of lack of resources. They may lash out at a little thing because of something much bigger. Example, lack of resources. On the next slide, I'm going to share two different cycles. For these examples, your autistic individual needs surgery, but it goes haywire and they have to stay an additional night. Parents/caretakers continued. Individual needs surgery, so you budget for it. Something goes haywire and they need to spend an additional night, but you can't afford it. Parent goes into a negative self-talk spiral, ultimately leading to, "I can't do this." Now, same song, second verse. Individual needs surgery. You budget for it. Something goes haywire and they have to spend an additional night. You know that your disabled individual has Medicaid and they cover the hospital stay. Parents less likely to go into a negative self-talk spiral. And this can go for also, I know, caregiving and having babysitters for any other siblings and stuff can impact it too, but this is just one of the examples that I chose. Parents/caretakers continued. So, how can we help the parents? Identify what resources are available to help the disabled individuals. Example, SSI, respite. Utilize social workers or child life to help find resources. Parents need therapy too. Connect parent to support groups. Utilize chaplain services if you're religious. Journal. Go for a walk in the hospital garden. Shift switch with a partner if able. In conclusion, we can all do better to help support autistic individuals and their parents/caretakers. And keep in mind, I am just one individual with autism and other disabilities. And, your autistic individual may not be able to do something like this or advocate or whatever, and that's completely okay. And it's important to love them exactly as they are.